Hi everybody. This month is a Sarcoma Awareness Month. As you all know, it is mainly a very ill-informed disease. Not many people know about this. So that's why we wanted to create a role of awareness. Sarcoma essentially tumor of the bone and soft tissues or the nerves and the muscles. So essentially they are the tumors of that. Many people ask me, sarcoma is the same, cancer is the same. No, both are different essentially. Sarcoma, they behave totally differently than the other cancers. Sarcomas essentially they are mainly seen in children. These children are basically they are from age of 5 to 15. One important message if somebody has to learn in this year for sarcoma awareness is any child which has got a night pain, say about 1 week, 2 weeks, and the pain is not going with regular dose of analgesics, then it is a cause of concern. That means this parent or somebody would have gone to many doctors, 1 doctor, 2 doctor, 3 doctor, but still the pain is not coming down, and the child is waking up in the middle of the night, and there is no history of a fall or a bicycle fall or a hit or whatever you call it, any injury, no football injury, any of those things are not significant, and the child is having a pain around the knee joint or around the shoulder, that is really a cause of concern. So that is when we should get alerted in 2024. That too, if you are living in India, that means it is very ideal to get a MRI done. A local MRI is very important and is better than X-ray, because in India it's so easy to get an MRI done. And the MRIs are available everywhere, and it is very fraction of a cost. This may not be possible in any of the developed countries like US or Europe so easily to do it. There is a policy change and all needs to be done. Taking the advantage of our country, definitely we should pick these cases early, and that is directly related to the outcome of a child. That means a child can be completely cured and they can be finishing their whatever their dreams, they can live life. I have children whom we have treated about 13, 14, 15 years back. Now they're finishing professional courses like engineering, medicine. It's so important to have a long-term picture in these children. That's why early detection is equal to very good outcomes. So that's one important point I would suggest. So we'll go to another one. Presently in our country, there is a lack of uniform policy on the treatment. Why I'm telling is that because unless you have a right treatment first time, you cannot achieve cure, or you cannot think of having a very good quality of life also. Why this is the problem? Essentially because sarcoma, first of all, it is one of the, I would say, given a care of like a stepmotherly treatment. It's not many people are very specialized in sarcomas, because less than 1% of cancers are sarcomas. So to have a specialized sarcoma experience, it needs a lot of expense or investment, resources. So which so far either I feel there are only 1 or 2 organizations, including ours in India, who are exclusively mastered this sarcoma methodology with the help of a lot of international centers like Rizzoli. We have taken help of many centers to develop this program. Right treatment first time is very important. What is right treatment? What do you mean by right treatment? Do you mean that right treatment is not given everywhere? I totally believe that, because sarcoma treatment, it needs a lot of teamwork, a lot of resources, a lot of thinking. So all these things comes at a cost of a huge investments. So not where every smaller hospital or smaller setups cannot afford to do that. Essentially, that's the whole reason why I'm telling is, for example, in osteosarcoma, how many centers in India give MAP regimen, which is the right treatment? No, not many. I would say 90% of them would not give it. That is directly related to the outcome. Whatever anybody says, no, we have seen the same outcome. No, show me the papers. There are no papers. What I mean to say is, we have to start early detection, the first point. The second point is the right treatment first time. And the third one, when we start the treatment, the most important one, the logistics. The logistics means in osteosarcoma or in Ewing sarcoma, the duration is about 8 months to 1 year. This 8 months, the logistics, it could be because of availability of the right specialists, availability of the right infrastructure, availability of the right finances, availability of the right support staff is very important.